tayo again. O, sandali lang ha, at I will just share you the slide.
Okay.
CNA.
So we're back. The slide is on.
Yes, ma'am.
Okay. So going forward, dito na tayo sa pinag-uusapan nating standard precaution. So hand washing, hand rubbing, PPE, respiratory hygiene, cup etiquette. Okay, so we have done with this one, patient care in equipment na tayo. So we said it's the handling equipment that might be contaminated with blood and blah blah that prevents skin and mucous membrane. So exposure, contamination of clothing. So kailangan dito, we'll take care of our equipments very carefully. We handle them very carefully. So disinfect them most of the time. Kung parati tayong merong mga, usually nowadays, hindi na natin, hindi na tayo gumagamit ng mga moist, mga towelettes. So meron na tayong cubby wipes na tinatawag. Okay, so ito na yung ginagamit natin na anti-microbial or antibacterial wipes. Evaluate equipment and devices. So we have to evaluate our equipments and devices for potential cross-contamination of blood. They should also establish procedures for the safe handling of such equipment during and after use, including cleaning and disinfecting or sterilizing as indicated. So ini-evaluate natin ano ba ang kailangan nating mga equipments, how to clean them na to avoid yung mga cross-contaminations. 7 is to clean and disinfect the environment. How to do it? So in cleaning, it is the necessary first step of any disinfection process. So cleaning removes organic matter, salts and visible soils, all of which interfere with microbial inactivation. The physical action of scrubbing with detergents and surfactants and rinsing with water removes substantial number of microorganisms. So ang cleaning, yung by the use of yung water and soap. So yung disinfection, as I said kanina, ang disinfection, it destroys most. Remember this, most lang ang dinidestroy. Most pathogenic and other microorganisms by physical or chemical means. While sterilization destroys all. All microorganisms, ito yung sinasabi kong 100%, by using steam autoclave, dry heat, and unsaturated chemical vapor or liquid chemical sterilants. So, yung sterilization ay yung all microorganisms ang being killed. While yung disinfection, it only destroys most pathogenic lang. So, hindi lahat. So, yung disinfection is just being used pagka yung mga simple na mga equipment lang. But yung mga, especially for the dental instruments, gumagamit na tayo ng mga sterilizers. Like yung mga operating room procedures, yung mga instruments nun, ginagamit na doon na sa sterilizing machines. Management of linen and laundry. The best practices for linen and laundry handling: always wear reusable rubber gloves before handling soiled linens. So during the bed making o nagpapalit tayo ng mga bed sheets, kailangan mag-wear tayo ng gloves. As I said, evaluate nyo, assess nyo muna, ano ba ang kailangan ko before I do this procedure. So if you think na kayo ay ma-expose, so you better use gloves. So kung alam nyo naman na masyadong dirty o infected yung inyong mga gagawin, you better use mask. Never carry soiled linen against the body. Keep them away from you. Even kung ikaw naka-plastic apron, but better to keep them away from the body or to prevent yung uniform or yung inyong apron. Carefully roll up soiled linen to prevent contamination of the air, surfaces, and cleaning staff. Pag nag-i-strip tayo ng bed, magbe-bed make tayo, yung magpapalit tayo ng kama ng pasyente, magpapalit tayo ng bed sheets ng pasyente. So it is a rule na dapat i-fold mo or i-roll over mo yung when you collect the soiled linen, i-roll mo over. Huwag mong pagpagin, huwag mo siyang basta damputin. Okay, i-roll mo, then immediately place it inside the soiled linen hamper. Transmission-based precautions. Transmission-based precautions are the second tier of basic infection control. Second level na siya. And are to be used in addition to standard precaution. So the standard precaution, yung ating mga hand washing and yung ating mga sharps, safe sharp handling, ito na yung second level. Okay, so in addition to the standard precaution, for patients who may be infected or colonized with certain infectious agents, for which additional precautions are needed to prevent the transmission of infectious material. We have 3 transmission-based precautions. Number 1, we have the contact precaution. Use contact precautions for patients with known or suspected infections that represent an increased risk of contact transmission. Yung sinasabi natin na masyado tayong close at nagkakaroon tayo ng during that closeness, meron tayong, you might get infected or you might get the bacteria will be transferred to you. So yun yung mga contact precaution, yung mga social distancing, medyo lumayo-layo ka ng konti, 1.5 meters distance, yun yung contact precaution. But if yung droplet precautions, use droplet precautions for patients known or suspected to be infected with pathogens transmitted by respiratory droplet. Yung kagaya ng yung may coughing, may sneezing, talking. So ang i-observe nating precaution must be droplet. Yung alam natin na mayroong drops off yung kanilang mga sneeze, yung coughing nila. So contact precaution, droplet, and the third is airborne precautions. Use airborne precautions for patients known or suspected to be infected with pathogens transmitted by the airborne route. Ano ba yung mga diseases na kailangan nating maging precaution, maging preventive measure natin is the airborne precaution. Yung may mga pasyente tayo na may TB, tuberculosis, measles, chickenpox, disseminated herpes zoster. Kasi airborne, bakit? Virus ito. So through the air, yung nasasama yung virus dun sa hangin. So pag nilipad yon, ang tendency nun, masinghot natin sila. So magpupunta yun sa respiratory system natin. Like the COVID. Okay, one example also is the COVID. So kailangan natin ng airborne precaution. Means to say, we need a mask for the airborne precaution. Ito yung mga example ng mga signposters. So whenever we have a patient in our healthcare facility, you will find itong mga precaution na to either doon sa loob ng pasyente, doon sa patient care area, or doon sa labas, ililabel doon sa mga pinto ng mga pasyente. Contact precaution. So you are aware na yung pasyente sa loob ay kailangan ng contact precaution. Bago ka pumasok, alam mo ano ba ang dapat mong suotin. So, mag-sanitize ka, what process you will do? Magsasanitize ka or mag-wash ng hands, then you will be putting your PPE as in yung mask mo and your gloves. Kasi contact, you will be exposed dun sa body fluids, your hands will be touching yung mga sweat ng pasyente, discharges of the patient. So contact precautions, yun ang kailangan natin. The gloves and the mask. If it is droplet precautions, the same thing, yung poster na to, if the patient dun sa loob ay for droplet precaution, sa labas ng door niya may poster. Droplet precaution. So they are just binibigyan kayo ng caution na yung pasyente natin ay nangangailangan ng droplet precaution. So ano ang kailangan nating gagawin? So meron the same thing, merong hand washing or yung ating sanitizing, meron tayong mask. Okay? So yung mask, so depende na lang if you want to use yung mga gloves ninyo. But mostly it is the mask that is needed for the droplet precaution. Airborne precaution. Ano yung poster na nagsasabi dito? So once your patient is diagnosed with like tuberculosis, COVID, so airborne sila, viral ito. So dun sa labas ng inyong mga pinto ng pasyente, may airborne precaution. At nangangailangan ng sanitizing, hand washing, yung iyong hand, yung mask, yung iyong gloves if necessary. So if either yung gown mo o obra pa rin, so it depends kung ano yung gravity, kung hanggang saan yung gravity, kagaya nitong ating COVID, for example. So kailangan yung PPE natin talagang complete. So may airborne na siya kasi magkakasama na eh. May airborne na siya, may contact pa siya, meron pa siyang droplet. Yung droplet hindi pa naman. Pero mas meron nang mangyayari pa na may droplet. So altogether, yung tatlo na yun, kaya complete yung PPE ninyo whenever you are taking care of COVID patients. Number 10 is to ensure appropriate patient placement. So we have mentioned before, a patient placement coordinator. Usually yung mga malalaking ospital, may mga patient placement coordinator. They are the one responsible in taking care of yung beds, kung saan nila dapat ilagay yung mga pasyente. They are called bed coordinator o patient placement coordinator. They are usually nurse din ito. Okay, so they are the one responsible kung dun saan nila ilalagay, pwede nilang i-place yung mga pasyente. Kung yung pasyente nila, it will be yung may mga information in conjunction with medical staff nga. So itong medical staff, either siya ay bed coordinator, nurse, patient placement coordinator. So nagpa-plan sila saan nila dapat ilagay yung pasyente. Okay? Waste management and disposal. Waste is defined as anything which is not intended for further use. It is termed as waste. Anything that is not useful. Waste na ang tawag natin doon. Wala na siyang purpose. It's not already intended for anything. So it is a waste. And medical waste is any kind of waste that contains infectious material or material that is potentially infectious. Anything that has in contact with the patient, lahat ng ginamit ninyo, mask nyo, everything, doon pinupunta, doon inilalagay sa medical waste. Hospital waste is any waste which is generated in the diagnosis and treatment of human beings in the healthcare facility. Kabuuan na yon, yung the total of itself. Lahat ng medical waste, sharps, lahat na yon, it contained in a hospital waste. Waste management is the management of waste produced in the healthcare facility. So yung waste management, meron tayong tinatawag na waste management. It is under yung under ng operations of OSHA, yung Occupational Safety and Health and Environment yon. So sila ang nagmamanage ng waste natin sa ospital. So there are two kinds of waste. There are hazardous and non-hazardous. These two types of waste, yung hazardous are waste with properties that are potentially harmful to human health and to environment. Pag sinabi nating hazard, the root word is hazard, it's harmful. Anything that potentially causes harm. Hazard yun. Okay, so it is hazardous waste because they are waste with properties that cause or can potentially harm human health and environment. So they are called hazardous waste. Non-hazardous are the waste that does not cause any harm to human beings and to environment. So hazardous ang pinag-uusapan natin when we are dealing in a hospital waste. Infectious medical waste are waste contaminated with blood. So we have around how many types of hazardous waste? We have number one, the infectious medical waste. Infectious medical waste, ito yung ating medical waste na nakalagay dun sa yellow, are waste contaminated with blood and other bodily fluids. Example, yung mga discarded diagnostic samples, cultures, stocks of infectious agents from lab work, waste from autopsies, infected animals from lab, or waste from the patient in isolation ward. Ang total of this infectious medical waste, it's considered lahat ng contact yung ginamit na kinontact with the patients are infectious medical waste. Any materials having been in contact with infected patients, any cultures growing of microorganisms in a nutrient medium, yung gelatin dun sa test tube, waste from surgery and autopsies. So lahat ito considered as infectious medical waste.
Medical waste.
Pathological waste are waste that originates from tissues or samples of tissues that are suspected and or examined in the lab to diagnose or study. So itong pathological waste na to, usually it comes from the laboratory. Okay? They are human tissues, body parts, and organs. Fetuses, yung mga stillbirth, so doon inilalagay. Unborn yun, mga vertebrae. Blood and body fluids, pathological waste ang tawag dito. Okay? Usually, the pathological waste is put in a red bag. Sa red bag yung pathological waste. Sharps. Sharps are objects having an edge or pointed that is able to cut or pierce something. So what are those? They are the needles, syringes, infusion sets, saws and knives, surgical blades, broken glasses, any other items that can pierce the skin, cut and puncture. Lahat ng sharps, anything with the sharp edge. Yun yung ating ilalagay sa sharps container. Pharmaceutical waste is another hazardous waste. So it is defined as any chemical or biological product medicine that is intended for use in the diagnosis, cure, mitigation, care, treatment, or prevention of disease or injury of a human. Pharmaceutical waste are those coming from yung pharmacy. Okay, yung mga chemicals na pinuproduce nila doon, yung gamot nila doon, yung biological product na medicine, na it can cure, it can treat, it can prevent disease or injury. Lahat ito ay considered pharmaceutical waste. They are expired or unused pharmaceutical products, spilled or contaminated pharmaceutical products, surplus drugs, vaccines or serum, discarded items used in handling pharmaceutical. For example, yung mga bottles, gloves, masks, whatever you use within the pharmacy. They are called pharmaceutical waste. Genotoxic waste. Genotoxic waste are waste that have mutagenic, yung nakapagpuproduce ng mutation, yung nagdo-double. Teratogenic, kagaya yung mga pasyente na sabi nila umiinom ng mga gamot and it produces yung mga deformities, yung mga abnormalities sa bata. O yun yung mga teratogenic na mga genotoxic waste. Or carcinogenic properties, yung mga ginagamit sa chemotherapy. So they are all genotoxic. Cytotoxic drugs, yun yung mga carcinogenic, toxic drugs ang tawag sa kanila. Yung mga vomiting, feces, urine from patients with nagki-chemotherapy, yun yung mga nagre-radiotherapy. So lahat noong ginagamit within that, genotoxic ang tawag doon. Yung may mga radioactive. Yung inilalabas nila sa kanilang pawis, yung kanilang diapers na sinusuot, all of those, it will fall inside of the genotoxic waste. Chemical waste are disinfectants, solvents, reagents used in the lab purposes, yung batteries, heavy materials, yung mga mga mercuries from the broken thermometers. Nowadays, ikinat na nila yon, binan nila using yung mga mercury contained doon sa thermometers and the blood pressure machine. Blood pressure monitoring apparatus. Kaya makikita nyo ngayon yung mga digital na mga lumalabas mostly, or yung mga tawag dito, yung mga as long as there is no mercury in it, yung mga hindi na content ang mercury. So binan na nila ito because it causes dun sa mga diseases na nagkokos ng mga mercury, mga lead, mga ganon. Okay, so those chemical waste they are from disinfectants natin. Yung ating mga solvents, reagents na being used in the lab. Yung ating batteries nga, mercuries, heavy metals, yun. They are chemicals from diagnostic and experiment work, cleaning processes, housekeeping and disinfecting procedures, mercury waste such as from the broken clinical equipment spillage, yung cadmium waste from the batteries. So all of those, it is contained as in a chemical waste. So lahat yun, chemical waste ang tawag. We have, the last is the radioactive waste. These waste include liquid, solid, or gaseous waste contaminated with radionuclides generated from in vitro, outside, analysis of the body tissue fluid, or in vivo, body organ imaging, and tumor localizations, and investigations and therapeutic procedures. So lahat ito are radioactive waste. So they consist of either liquid, solid, or gas, yun yung from the in vitro or in vivo. So ito yun, it can also consist of any glassware or other containers contaminated with radioactive liquids. Lahat ng may contain of radioactive ay especially dito nakikita ninyo itong mga radioactive containers, bakit siya merong symbol na ganon? So itong symbol na to means ay radioactive ito. So radioactive means toxic, yung very toxic siya, hazardous. Okay? So be careful with the symbols also. Non-hazardous waste. What are the non-hazardous waste? As we speak, general waste is no risk to human health. So yun yung mga office supplies, paper wrappers, kitchen waste, general sweeping waste, all except for the medical waste and the sharps. So lahat na yun hazardous na. Number 12 is notification of communicable disease. As we talk about the notification, it is important for the ICN. Siya lang yung nagre-report. You will be the one reporting pag kayo yung nakakita ng report, but then it is the sole responsibility of the infection control nurse kasi meron silang binibigay na username and password to report. Sila yung legal na magre-report sa health authority or the preventive medicine. So all communicable diseases and infectious diseases are to be reported to the health authority or to preventive medicine in Abu Dhabi. Number 13 is immunization and vaccination. Vaccination is the most effective tool for controlling and eliminating serious infectious diseases, preserving public health and protecting lives, and Department of Health's vaccination is essential campaign that brings attention to the fact of immunization and vaccination. Vaccination is when a vaccine is administered to you, usually by injection. So vaccination yon. These are two different things. Immunization is what happens in your body after you have been vaccinated. So the vaccine stimulates your immune system so that it can recognize the disease and protect you from future infection. You are becoming immune or you are already becoming immune to the infection. Kaya nga pagka nagba-vaccinate tayo, nag-i-immunization campaign or program. Hindi ba like yung flu vaccine. So nag-i-immunize tayo to protect the individual from the flu. So yun, tumataas yung yung resistance natin and our increase of immunity. So may malakas na prevention na tayo doon sa mga infection na darating sa flu or kung ano man vaccine yung ibinigay sa atin. Sterilization of medical and dental instruments and equipments. So sterilization is the use of physical or chemical procedure to destroy all microorganisms. Again, to destroy all microorganisms, to kill all microorganisms. 100% of microorganisms are being killed through sterilization. So includes substantial numbers of resistant bacterial spores. It is also refers to killing or removing of all visible, viable microorganisms. Viable means yung mga alive na microorganisms. So they are capable of killing all 100%. The aim of sterilization is to break the chain of potential cross-infection between patients by killing microorganisms, including bacterial spores. Sterilization using a steam sterilizer or autoclave. So ito nakikita lang natin ito sa CSSD. There is one department within a healthcare facility, yung malalaki o yung maliit na mga medical facility, medical centers, it depends yung laki ng hospital o yung liit ng medical center, doon yung gano'ng kalaki yung ating steam sterilizer. So depende kasi yung iloload nating mga instruments. So it is recommended as most efficient, cost-effective, and safe method of sterilizing, especially for the dental instruments in a primary care dental practices. Mostly, ang ginagamit dito sa sterilizers, yung mga operating room instruments, yung ginagamit talaga ng doktor during surgery, and yung mga dental, dun sa mga dental care centers. Sterile means, root word ito, sterile. Sterile means from the living, free from living organisms. Sterile. So, sterilization is the process to kill all microorganisms, all viable, all living microorganisms or the bacterial spores. So these are the photos of the steam sterilizer. Yung maliit to the left, usually yung maliliit na medical center, they are only having like this small. Dalawa or tatlo nito. Kasi masyado nang malaki yung right, that one is being used by the big hospitals. Mga 6 siguro niyan do sa malalaking ospital. Kasi ang operating room nila, mga 6 din. Okay, so it depends on how big is the hospital or the healthcare facility. Yung steam sterilizer or autoclave machines, they are called both. Either steam sterilizer or autoclave machines. So they are being used inside of the central sterilization and supply department, CSSD. Okay, so doon yan ginagamit, yung processing. So then, we are going to talk about disinfection. We touched this disinfection and we have known the meaning of disinfection. It is the process of removing or killing most. So tatandaan natin, by disinfection, it is only killing most but not all. So yung disinfectant na ginagamit natin, yung chemical agent used to destroy all recognized pathogenic microorganism but not all. Disinfection but not all. Most lang ito. Not all microbial forms, bacterial endospores, hindi sila ganun namamatay. Asepsis is the root word, is the medical term. May prefix siyang A for the sepsis, free from dirt. So asepsis is the prevention of microbial contamination of living tissues or sterile materials by excluding, removing, and killing microorganisms. So when you come into yung term na asepsis, A means is prefix to the root word of sepsis. So absence of microorganisms or absence of dirt, asepsis. So we'll touch a little bit of COVID. Okay, so let's get an information about COVID. So I know every one of you are much updated with the COVID right now. Okay, so siguro lahat ng makita nyo, ma-Facebook ka, ma-newspaper, any articles, may COVID, di ba? So just for yung updates lang na information, COVID-19 is an infectious disease caused by a newly discovered coronavirus. Okay, ito na yun sa 2019-2020. The new coronavirus is a respiratory virus. Kaya pagka na-inflict ka nito, tinamaan ka talaga niya, ang affected is the respiration. Hindi ka na makahinga, which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. So ito, sabi niya rito, di ba, droplet siya. So yung mga inuubo, yung may mga cough, yung may mga saliva na discharge from the nose and from the mouth. So kailangan natin ay droplet precaution. Pero they are saying, most of them, according to the updates, aerobic na rin daw. Yung from the air na rin. Sumasama na rin sa air. So, hindi na natin alam ngayon kaya kailangan nag-full gear na tayo. kompleto na tayo ng PPE.
Picture,
Because
cigarette.
dun sa mga signs and symptoms niya, may fever, dry cough, runny nose, difficulty of breathing, and headache for the most na, yung serious na. So one of those asymptomatic symptoms, bago ka magkaroon ng symptoms on the first 3, doon ka palang makaka-feel na magkakaroon ka ng COVID. But there are some, that they are asymptomatic. Pero nagpa-positive dun sa result ng kanilang PCR. Yung kanilang nasal and the oropharyngeal swab, nagpa-positive sila, asymptomatic. So maybe because the reason bakit asymptomatic sila pero positive, baka nandun na yun, nauunahan lang nung iyong preventive measure. Siguro, sabi nila, nag-i-steam, umiinom ng salt, meron kang high dose of vitamins, vitamin A. So, yun siguro, nagpa-positive siya while there is no symptoms. So, nako-cover upan na nung iniinom niya. Positive nga siya, but it's not showing. Not unless you are already with such serious na may difficulty of breathing ka, may headache ka kasi na-invade na yung iyong respiration, yung respiratory system mo. So, hindi ka na makahinga ngayon. So, ang ating precautionary dito sa ating COVID ay definitely, ito ay, tawag dito, yun ay aerobic. Infectious droplets and droplet nuclei, travel length, sabi niya dun sa droplets. So yung pinaka-most less is 1.5, 1.3, 1.5. So may social distancing tayo. So to the most is 5 feet. Okay? So 5 feet and more. So yung social distancing natin, binigay sa atin na CDC, as per the CDC guideline, 1.5 yon, 1.3, 1.5 to 5 itself. So how to prevent the spread of COVID? So everybody knows how to spread, right? So how we are using our preventive precautionary measure. So number 1, the first and foremost, proper hand washing and frequent hand sanitizing. Ito yung talagang advisable. COVID advisory from the CDC and WHO is to proper hand wash and frequent hand sanitizing. Proper cup etiquette. So again, itong respiratory and cup etiquette, sundin natin ito. Practice natin ito whenever we cough or sneeze. Social and physical distancing of 1 to 5 or 3 to 6. Avoid crowded places. No sharing of personal things. Always wear face mask. Yun namang N95, kinakailangan lang yun when we are so sure may COVID positive yung kaharap natin. Okay? Because why N95? It filters 95% of the microbes, microorganisms. So yung virus niya na-filter ng 95%. That's why it is called N95.